Well, I think an important innovation that has come in recently are health savings accounts. Basically, this gives the possibility of high deductible health plans accompanied with tax-favored savings accounts so that patients become consumers of health care. So they pause,
shop around more.
Shop around, think about what things are costing, and try to get good value for their dollar. I think, you know, we want to have people with insurance, but I think you can have over-insurance. And if people think that somebody else is paying the bill, they don't really think about what they're buying.
You guys, at least in the Medicaid area, have something called the Consumer-Driven Assistance Program, which is a pilot program started under Owens. I'm assuming it's still going on, where some Medicaid patients actually get cash and they can spend what they have and they can use the excess, part of the excess, for durable goods and to purchase things that they couldn't have before. We've talked about this on this program many times. It's been very successful as far as I can tell. Is that something that has been expanded?
It's expanded in a couple of areas. One is a bill actually that was passed by Senator Owen and myself in 2006, and it took until 2008 to really get it rolling. And that was for persons with disabilities. And we have discovered that if they direct their own care, they can usually get more per dollar than they can get any other way. And so it's giving them the money. And now we eliminate those silos. We're not putting dollars into 3 different cups, and when that one's gone, you can't get any more benefits out of that one. You can only use this. We put it all in one cup and say use it the best way that you can.
It also allows the patient to have more control over their own services, so they can hire somebody they like. If the person doesn't treat them well, they can fire that person and go and get somebody else.
Exactly, and patient responsibility is very important. The thing that's going to break the bank on health care is chronic disease. And most people don't have a single chronic disease, they have multiple chronic diseases. 85% of all chronic diseases are avoidable. And this is why the wellness
like baldness?
Was so important. Probably not like baldness, but if people learn to take more responsibility for their own health, then they can achieve a great deal more, and we won't have these multiple chronic diseases as people age. And once you have a chronic disease, I mean, by definition, you're going to have it as long as you live. And so in Medicaid, for example, 96% of the dollars go into services, and only 4% goes into education. That's one of the things we need to change. So we're spending more money on these wellness programs. We're teaching people how to assume more responsibility for their own personal health, and so they'll live healthier and the costs will be driven down.
One of the reasons healthcare is pretty expensive here in Colorado, at least insurance, is we've got a tremendous amount of mandates that if you want to buy a policy but you don't want maternity coverage because you're not going to have any kids, or you don't want to have mental health coverage because you don't feel you need it, well, too bad. That's all you're going to get. Here in Colorado, it's impossible or it's illegal to go off and buy a policy in another state. Let's say that Nebraska, one of our neighboring states, sells a policy that's been regulated there, but it doesn't have a lot of the bells and whistles, and I might want that policy. I can't get it. Will you address the idea of buying policies from another state? This is something other states are starting to look at, and I think Colorado could be a leader. Bring it here.
There was a bill that was introduced this time. It's been introduced at least twice to try to encourage this. I would support it because there are some states that might have a more favorable regulatory environment that we have here, even though I would say that Colorado's regulatory environment is not as bad as some states in terms of buying health insurance. But there are some complexities there. If you buy insurance from another state, which insurance commissioner is going to handle complaints if they arise? I would prefer to frankly see this done at the federal level because of federal law, insurance is regulated at the state level, and I think we need to have some cooperation with the feds. But I think having
Representative Shattuck tried to do such a bill, got shot down very, very quickly.
Yes.
So the idea that maybe it's up to the states to loosen up the reins and let us buy policies someplace else. What do you think of that?
We need to look more regionally. It's very possible that someone living in Durango, the best physician for them is in Albuquerque, and someone living in Raymer, Colorado might be going to Scottsbluff. And so we need to look at regionally. How can we establish this so that you can have coverage? The bill that came up this year did not pass. It's something we need to continue to look at, but I think it's more regional than it is either state or federal.
All right, we've only got a couple minutes left. If if you could wave a magic wand, now let's talk on the state level, if you could wave a magic wand and pass any sort of legislation that would really help us on health care, Spencer, what would you do? You're the legislature, you're the governor, you're the king. You can make any change you wish. Where would you be directing us? Where would you be pushing us?
I hate to dodge the question. This is a tough problem. One of the problems is that I'm a baby boomer like so many others. As we get older, we just become more expensive to take care of. There's all this fabulous but very expensive medical technology out there, and it's simply driving costs up. You know, I would like to see the market take the leadership, though, in this area. I'd like to see more competition. If I could remake the world, I'd like to see us look more like eye surgery, for example. Never paid for by insurance. Outcomes get better and better, and cost goes down and down. And
because it's a very competitive,
very transparent, and it's never
consumers make the choice whether to go to this surgeon or that surgeon for.
And it's never paid for by insurance. But the problem is LASIK is very low cost relatively, and we can have a heart attack or cancer that's enormously expensive, and we've got to have insurance. So it's complex.
Jim, let me bring it over here.
I think we need to untie it from necessarily being tied to employment. I'm not sure why. Insurance only is provided, a bulk of it is provided by employers. I think we need to make it easier to break away from that. I think that would be something very important. As I mentioned earlier, I think we really need to look at mental health coverage. I think we worked real hard this year to not do any more mandates to insurance companies because we can't continue to do that and control costs. We had a couple of bills come through late in the session that would have really thrown some high costs into insurance companies, which would have raised the premiums for all of us. But we need to stand back. We need to take a look at this. And as I said earlier, the personal responsibility. How important is it for us to take care of our own health? And then what can we create that allows people to use those and get the tools that they need and the coverages that they need in order to protect them, provide for themselves and their families. But we live in a society which, when they don't take good care of themselves, doesn't want to see anybody die on the street. So somebody is always stepping in to prop it back up.
Let me go the opposite way. We've only got a minute or so left. What's the thing we should avoid here in Colorado? I've got my thoughts on it, but you look around at what other states have done. What do you want to avoid in just a few seconds?
I would avoid turning it all over to the government. I just don't.
Kind of what Massachusetts have done. That type of plan.
That kind of approach. I just think that you stifle innovation. We have a very innovative healthcare culture in this country. We develop most of the drugs in the world, and I'd hate to see that go away.
Which will you avoid?
We have to develop a parallel plan, private, public. We can't do it one way or the other. We want to avoid taking it either one of those, either making it all private or all public. We need to find a way to work together.
Working together meaning?
Public-private.
Public-private. So you see that the private sector still has a large role in this?
Needs to have.
Absolutely. All right. Representative, thank you. Spencer, thank you. And by the way, thank you both for being out of session. If there's anything you can do to make me happy, is stay out of session. And thank you for watching. Tell a friend about Independence Institute. Check us out at independenceinstitute.org. Listen for me late nights on 850 KOA, and we'll see you next week. You jibber jab, bamboozle, nook and noozle, bippity bop, she call. I mean, you keep on talking, but you don't know where to turn it off. The day I met you, wish I'd been in Barry.